I'm Kayla. This is Kenneth, and this is Anila. We're all medical students, and we are here to propose a resolution for Medicaid expansion. During my time in Jacksonville, not only for rotations, but as a lifelong resident, I feel a deep sense of commitment to my Native community. It's this sense of commitment that drew me into medicine originally. I have not only personally experienced, but now I see firsthand how gaps in healthcare coverage affect real people in painful and often devastatingly ways.
So, for example, just last week, I saw a patient who came in due to a severe foot wound infection, and it was a complication of diabetes. And he had fallen into a Medicaid coverage gap, so he couldn't afford specialized wound care at an earlier stage. So by the time he reached to us, his wound had become infected with maggots, and it was rotting and just emitting a terrible odor. Um, his condition was far worse than it needed to be, and now we're discussing amputation for this patient. And of note, above knee amputations carry a 1-year mortality of 15 to 20%. And this is what happens when patients are forced to delay care until their condition becomes an emergency.
So it's not just isolated cases like this. In my experience with obstetrics working with the pregnant population, I've seen expected mothers unable to receive timely prenatal care because they lack coverage. These are mothers who want to give their children the best possible start to a prosperous life, but are blocked by financial barriers. Expanding Medicaid could give them and so many others the chance to access preventative care before issues escalate, protecting both their future and their health.
So we're here today because change just does not start at the top. It also starts at the local level here at home. While we actively continue to advocate to close the coverage gap in Tallahassee, where there's bipartisan support across the House and Senate, we need to show local grassroots support as well to ensure health systems change as well.
Here in Jacksonville, the impact of these gaps is especially alarming. Maternal mortality rates in our community are significantly higher than the state average, 33.2 deaths per 100,000 live births, compared to the 21 statewide. Many of these tragic losses are linked to conditions that could have been managed and prevented with earlier care. The commitment is really low, and according to the American Rescue Act, we will only have to put up 10%. It leaves us with an estimated 200 plus million in surplus according to the U.S. Census and Kaiser Family Foundation. That removes the burden from cities and counties. Right now, we are paying in lives lost and the higher cost of acute care as patients cycle through emergency room departments. Last year, the city paid more than $40 million to support uncompensated care costs at UF Shin's alone. While the city of Jacksonville is sustaining our local federally qualified health centers and free clinics, this is just putting a Band-Aid on a much larger issue. These organizations do not have the reach or resources to comprehensively provide the full spectrum of care patients in our community need. Without the expansion of Medicaid, we are in a constant cycle of spending more dollars serving patients with higher acute needs and more urgent situations, which perpetuates poorer outcomes and higher mortality rates. Florida has the opportunity to join the majority of states that have expanded Medicaid, extending coverage to the additional 570,000 people across the state. The data speaks for itself here. There are over 400 studies that highlight the benefits of expansion according to the Kaiser Family Foundation, and more importantly, no state that has expanded has ever reversed this decision. Supporting this resolution is a step towards a healthier, more resilient Jacksonville, where our community members can access the care that they need before it's too late.